Healthcare is an industry like no other. It's a deeply interconnected ecosystem with countless diverse players whose interests can be both aligned and at odds at the very same time. In the wake of recently passed healthcare reform legislation, it's tempting to think that the delicate balance among the players has suddenly been upset. But well before reform was enacted, the disruptive forces of change were already at work on the healthcare industry. With healthcare expenditures consuming some 17% of U.S. GDP, we long ago entered the backside of the cost-benefit curve, with the highest per capita healthcare spending in the world, but with far from the best results. Despite the obvious problems with the status quo, the industry has been remarkably resistant to change. Of course, the inertia is understandable. Change is disruptive. But every disruptive force provides an opportunity to build sustainable advantage. In the face of these disruptive forces, we believe convergence is the inevitable result. In some cases, a convergence of the players themselves, but in almost all cases, a convergence of their interests. The difficult part isn't getting the players in the healthcare ecosystem to agree on the goal. They already do. It's health. The difficult part is getting everyone to make the changes necessary to achieve it, to solve the complex equation that balances cost, quality, and access. If we are to advance from care to quality care to health, the priorities, incentives, and business models of stakeholders must be aligned to create a more collaborative working relationship. Considering the diversity of the stakeholders, this is no small task. But by the same token, the magnitude of the problem means only that the opportunities are equally as large and plentiful. We can see the rapid acceleration of this transformation today through many innovations. Yet these innovations can raise as many questions as they provide answers. And for many, it's not the changes themselves, but the pace of change that's most troubling. All of the industry constituents are challenged with a perfect storm environment, multiple pressing mandates, fleeting opportunities, and shifting business models, all at a time of domestic and global economic uncertainty. Exceptional execution isn't discretionary. To survive, healthcare organizations must find ways to increase agility, be more decisive, focus more on the future, and be more responsive to change. To meet the challenge, KPMG Healthcare now brings together over 1,500 partners and professionals from our provider, payer, pharmaceutical, government, and life sciences practices to serve the business of healthcare. We're one of the few firms that has performed meaningful work across the entire spectrum of healthcare stakeholders, from government health agencies to the major health insurers, and big pharma to the top healthcare systems. This experience enables us to connect the dots and understand how the pieces fit together. It enables us to approach each engagement with a broader understanding of the issues and the implications for how they're addressed. This experience has also reinforced our understanding that no matter where you are in the complex healthcare ecosystem, healthcare is ultimately about the patient. For us, this perspective is more than just words. It drives the design of our healthcare services, from the development of our people, technologies, and methodologies, to how we measure success. Through our experience across all segments of the healthcare industry, we're able to offer a broad range of services that are designed to help you work more effectively within the highly interconnected healthcare ecosystem. And because we provide both strategic advice and support in execution, you get actionable recommendations and measurable results. The immediate objective of any transformation is a clear and definitive end state. But our measure of success goes beyond simply getting you there. It also includes helping you be better prepared for the next disruptive force, to be proactively equipped to take advantage of it. Leading healthcare organizations around the world rely on KPMG to help them see themselves more clearly in the sea of change, both where they are today and where they'd like to be. And our multidisciplinary teams provide the tools, techniques, and expertise to help them get there. In a word, the value we offer is confidence. Confidence in your strategies. Confidence in your execution. Contact us, and we'll show you how KPMG can help you take advantage of seismic changes facing the healthcare industry and transform disruptive force into sustainable advantage.